Okay, so next topic we have the ultrasound, a regional ultrasound. Kung pamatandri is the patient preparation. Okay, so first we have the ultrasound of the whole abdomen. The whole of the abdomen can include the liver, imong HBT, the kidneys nimo, the ureters nimo would also be checked. Some parts of your intestine if there's problem with your intestine, and then of course the urinary bladder, and then kato yung mga silingan. Diba? For the female, the most common is the uterus or the gonads of the female patient, and then for the male it's the prostate that is commonly checked after the urinary bladder. So diba, during your internship program, you have been assigned in the reception area in order for you to interview the patient, and then of course in order for you to instruct the patient on what to do. Like for example, there's a patient yun about, ma'am sir, magpa-ultrasound ko. Tapos pag tanaw nimo sa ihang request form, it is an ultrasound for the whole abdomen. So your instruction would be related to this, diba? Preparation, NPO, 6 to 8 hours, or dili pa kanon si patient, approximately 6 to 8 hours before the procedure. And then, another for the instruction pod sa, diba, is you have to ask the patient to drink water, okay, or to drink a liter of water before or an hour before the examination. Like for example, 8 a.m. ninyo sila schedule. So by 7, dapat nakainom na si patient of water in order for the bladder to be filled with water. Para during the examination, if ever male ang patient, the radiologist can check for the prostate of the male, and if ever female atong patient, then most commonly to check for any problems with the uterus. Okay? So dili pwede nga for example 8 a.m. mo schedule tapos 8 pod sa nimo gipa inom si patient og kuan o water. So that means the full bladder would be at butan nato approximately 9 a.m. So madelay pa og ayo si patient. So that means ang yang NPO would be lengthened na pod. Okay? So if ever ma-lengthen og ayo ang kaning fasting ni patient, this would be the result. No? There would be an accumulation of air in the epigastric region ni patient, and then sludge formation. Like for example, in this image, we have here the image of an abdominal examination. This is approximately at the gastric nga portion, the epigastric nga portion, in which na ay production of kumantay mo na, that is a dirty shadowing. Remember yesterday we have dirty shadowing. If ever naata dito sa mga kuan, naata dito sa gas containing nga mga kuan, nga mga organs, like for example in the bowel, in the stomach, if ever dagan siya gas because of over fasting, then that could result to dirty shadowing in the image, diba kani? Na siya dirty shadowing. Then for the gallbladder, kini siya. This is your gallbladder, diba? This is the gallbladder wall. Siya. Na siya is sludge formation. That means ang imuhang fluid unta nga katong bile, imbes nga it is a very fluid unta nga material, since nag-fasting man ka tapos taas na kay mo fasting, what will happen is the bile becomes bara siya mag-solidify. Now that's why in the image, okay, nang mara siya mantika ba nga pag madugayan ganit nimo siya og dili gamiton, what will happen to the mantika, di ba, mara siya matulog. So some of those solid particles mo go down sila, and then the liquid niya nga part is to sa taas. Okay, so we have here the sludge nga part na sludge part sa imuhang bile. This is the fluid nga bile. This is the sludge nga bile na sa ubos. Tapos you have the gallstone. Okay, so if ever natay sludge sa ato ang gallbladder, so that means the gallstone can sometimes be, especially if dili kay solid ang gallstone, so dili pod na siya ma-demonstrate og ayo. Okay, so that's the disadvantage if ever na sludge formation sa ato ang gallbladder. So as much as possible, kung unsay schedule ni patient dapat imo gyud itunong pod sa iyang fasting nga time kay para dili ra kayo ma-overfast ato ang patient. Okay? So, di ba na ay acoustic shadowing. This is one of the artifacts. So, na ay black nga portion dire, no? Na ay hypoechoic nga portion, medyo grayish na nga portion. That is because of this solid material. Diba again kato yesterday, if ever na siya solid gani nga material, the most common niya nga resultant image is acoustic shadowing, no? Especially pag stone. Okay, so that means the acoustic shadowing, the artifact, is helpful in diagnosis or in diagnosing of the solid masses, especially for no, kani mga stones nato. No, they absorb a lot of ultrasound, so that means only little ultrasound will be transmitted dire sa iyahang likod. Okay, so that's why ni hypoechoic siya. And then this one, same ra ni atong ganina nga image actually. This is dirty shadowing. Okay? And then we also have the ultrasound of the hepatobiliary tree or HBT. That is the actual liver na siya. Liver and gallbladder. So preparation, mura rin gihapon tag mag whole abdominal examination. Also true for the upper abdomen nga examination, di ba? Upper abdomen nga examination and HBT and also whole abdomen nga examination. Fasting. Okay? Fasting. Okay, so nakalahi lang nila ni whole abdomen. Dito sa whole abdomen, since naaman dito si urinary bladder, so dapat na ay full bladder. For the HBT and then the upper abdominal nga ultrasound examination, no need to have the patient drink a lot of fluid or dili na siya kailangan nga mag full bladder pa for this type of examination. Okay, so these are sample images of the liver. But we have here a normal nga liver. Okay, and then this is part, sina na po itong multi-path na artifact. That means this is actually part of the diaphragm and then the liver. Diba na siya formation of the multi-path nga artifact. Okay, so that is the posterior portion of our liver. And then we have here, actually siya is normal. So the echogenicity of the liver is almost all uniform sa ato ang whole of the liver. And then we have a fatty liver. So in the examination of the liver, it is also important nga ma-demonstrate pod sad ni siya nga organ, that is the kidney. Okay, so it is very important nga naagid ni si kidney kay it can be used as a reference manggod, especially in their echo textures. Kay if the kidney is hyperechoic, very much hyperechoic compared to the liver, so that means maybe there's a problem with the liver, or if batang nato the kidney is very dark compared to the liver, so that means there's a problem with the liver. Or if, for example, the liver is very white, no, padulungay siya sa hyperechoic nga image, so that means maybe there's a problem with the kidney. Okay, so since dili kay sila parehas og echo texture, so that means there's a problem with the liver, so fatty. And then the kidney, supposedly dapat ingana gid ang color. Okay, somewhat hypoechoic. Sometimes they could be of the same color with the liver, and sometimes medyo lang hypoechoic, medyo darker lang siya compared to the liver because of course of its fluid content. Okay, daghan gyud fluid si kidney. Then you have here a cirrhotic na liver, which medyo distorted lang siya nga image. Now we have here a cirrhotic, that means nagharden ang iyahang tissue, nagharden ang imuhang liver. So kani siya, pag nagani cirrhosis ang patient, dito na ni siya sa advanced nga moderate to advanced nga cirrhosis ma-demonstrate sa ultrasound. Pag early stages, pag gani sa cirrhosis, usually dili pa kay siya gaka-demonstrate sa ultrasound. Na kanang iyahang fibrosis bitaw, dili pa kay siya ma-demonstrate. We also have the ultrasound of the KUB or the kidneys, the ureters, and then the urinary bladder. For the female, it is commonly termed as pelvic examination. And then sometimes for the male, it is termed as the prostate nga ultrasound, no? Prostatic ultrasound. And then pelvic ultrasound, no? Which includes, of course, the kidneys, ureters, and then the bladder. So the correct terminology should be KUB. Nakamaapil man eh, kidneys, ureters, and bladder. So if ever female itong patient, so pwede apilon ng iyahang pelvic portion or the gonads of the patient. Most commonly, laban na sa iyahang uterus. If ever na ay problem, kisilingan naman sila ni urinary bladder. And for the male, so it's the prostate that can be checked. Okay? Then preparation for the KUB, since target na to only is kidneys, the ureters, and then the urinary bladder, so dapat na siya i-intake nga fluid, no? An hour before examination, dapat naka-intake na si patient of approximately 1 liter of fluid in order for the bladder, the urinary bladder, to be filled with water. Diba? Para makita nato siya nga muna siya si urinary bladder that is filled with water. And then if ever the urinary bladder is filled with water, so ang yung appearance ana is an echoic. But that means no echoes should be produced inside of the urinary bladder unless of course kung ay problem. And if ever naka-catheter na ay urethral catheter si patient, so we have to clamp that catheter. So i-close na to yung for example na ay catheter nga naka-insert sa iyang urethra, so dapat i-clamp na to siya in order for the urinary bladder to be filled with fluid, to be filled with urine. Okay? If ever walay clamp, like a clamping material, then you can do the scotch tape, no? Pwede mo siya like, for example, this is the catheter, so you can kink part of the catheter, tapos you can place a scotch tape, no? The tape, para dili lang yun mo flow ang fluid or ang urine ni patient. Okay, so as mentioned ganyan, we have the normal, unta na to nga liver and kidney ultrasound. They should be of the same color. They are of the same echogenicity. Diba? Medyo darker silang gray compared to the surrounding. Apil po sa si kidneys, medyo darker po siya compared to the surrounding. But if there is a problem to one of them, so the other one becomes hyperechoic, and then the other one becomes hypoechoic. So for example, in this image, the liver is hyperechoic compared to the hypoechoic kidney. Now that means lesser echoes. This has more echoes compared to liver and then kidney. So that is one of the indications. So that's why kung makabantay mo, if ever mag-liver examination dito, ipangitaon sa doctors ang kidneys in order to compare the colors. And then if inyo pong tanawon ang mga printed nga images, the printed ultrasound images, kung tanawon ninyo na sila, na actually dito si liver and then si kidney nga nagtapad. Like for example in this image, no? Kani siya. So, na sila ikuan nito na ay dapat isa ka image ito nga naan siya. And then we have TVS and TRS. TVS, that is the transvaginal examination, transvaginal sonography. And then TRS, that is transrectal sonography. So preparation, similar gihapon dito sa atong KUB, is just a full bladder. It's most commonly done in patients having problem with their gonads. Okay? And if ever lalaki, then that is for the TRS transrectal. Then of course, TRS can also be done sa female patient if ever na problem with the uterus and then wala pa nakaagi og sexual contact si patient, or basically virgin pa ato ang female patient. Okay? And then we have the ultrasound of the chest. So for the ultrasound of the chest, there is no preparation related to ultrasound, but rather we have to ask for the history of the patient. Okay, most commonly, pag naagani tay ultrasound of the chest, that means there's a problem with the chest of the patient. So the most common problem nila ana is na fluid, or that's basically pleural effusion. Diba? Pag na pleural effusion si patient, that means na tubig ihang baga. So asam na siya ma-check, di ba? Most commonly through chest radiography, di ba? Na pleural effusion, asam na siya ma-check, di ba? Dito na sa X-ray. Kay pag X-ray sa iya, chest PA lugar, tapos naka-upright si patient, so ma-demonstrate dito ang air fluid level. No, because of the fluid content sa imuhang pleural effusion. And then to check if ever the physician would want to drain the fluid in the chest of the patient, in the pleural space of the patient, so they need ultrasound in order to guide them where to insert the tube, diba? The chest tube. Diba? The chest tube will then be inserted towards the chest of the patient, towards the pleural cavity of the patient, and then the chest tube will be connected towards a bag or a bottle outside of the body of the patient in order for the fluid to be drained. Then we also have the examinations in ultrasound that does not require any preparation. For example, for the baby, and a problem with the brain formation of the baby, so we can do cranial ultrasound. We can also do a thyroid gland scan that does not require preparation. The breast, kung liver alone, that means wala na siya preparation. No? Liver alone, that means dili apilon si gallbladder. Now, maybe makita pero dili siya ang target. And then we also have the kidneys, that means the kidneys alone. And then testis or scrotum, and then the BPS, di ba, kung sa mga buros pa lang na siya. Kaya then sometimes po sa, di ba, pag third trimester na ang ato ang pregnant patient, no, pag dili BPS, general lang sa examination, you call that as the pregnancy evaluation, laban na dito na sa third trimester. Di ba, di na siya kailangan of any type of preparation. Okay, so we have the pregnancy evaluation. Muna siya ang pinaka-common pinaka-common nga examination when it comes to ultrasound. So preparation, of course, you have to ask the patient for the patient's LMP or the last menstrual period in order for us to determine the gestational age of the patient. Kaya remember, di ba? The LMP, i-input ba yan dito sa computer? Sa computer sa ultrasound. Sa yung console. Therefore, the first trimester pagani, since ang examination ana niya is TVS, okay, so dapat naka full bladder. And then kung second to third trimester na, no preparation na ang kailangan. Kani siya, since gamay pa man kayo ang embryo anino, so dapat kailangan siya og daghan fluid. Pag abot diri sa second or third trimester, no preparation na because the fluid will be coming from the amniotic niyang fluid, di ba? So instead nga painom si patient, kay daghan naman kay sa fluid inside sa iyang lawas, so no need na. Di ba? The amniotic fluid becomes the window for the ultrasound beam para makapass through siya. Kung pwede mo aning sa first trimester, gamay pa kayo ang structure of interest, so dapat natay acoustic window. So the acoustic window is the urinary bladder.